It's our series, but it's your questions. What do you want to know about medical questions that are affecting you or your family? We call it Doc Talk.
That's right. And today, Dr. Leo Lopez, he is a medical director with University Health, is joining us live to answer your questions. And I'll start with this one. What trends are we seeing now with kids and the RSV and flu?
It's an important question, and we're still in the thick of RSV and flu season, and I'm certainly seeing this in my clinic. And in fact, across our health system, at the end of last week, we still had about 200 positive tests for RSV, about 160 roughly for flu. So this is still really contagious and can be really serious and dangerous, especially for our young kids and older adults.
Are other parts of the country seeing more RSV flu than we are?
You know, it's hard to say. I think one good place to look is at the CDC. They've got a hub of data that helps kind of break things down by region. But there are things that we can do here in our community, right in Bexar County, to help protect ourselves. In fact, for both flu and RSV, we've got vaccine products available. So definitely recommend folks connecting with their doctor, their local pharmacy to see about the availability of those vaccines.
Now, there's in that question there, whoever wrote that into us also wanted to know about the difference between those with RSV and flu and COVID, because when you're talking about diseases of the respiratory system, it's kind of hard to tell the difference or distinguish between them.
No, you're exactly right. And so there can be a lot of overlap between symptoms from RSV, COVID, and flu. For RSV, it can be a little more common to have that runny or stuffy nose. For the flu, it might be more common to feel a lot more tired, some fatigue, having those fevers. And with COVID, you can still have fevers and kind of the other symptoms of the other two infections. But then there's that characteristic loss of taste and smell. You know, for any of these, again, they're overlapping. You can seek medical care if you feel like you're feeling under the weather, and connect with your doctor again about these different vaccine products and/or if there's a treatment that's right for you.
All right, next question comes from Anonymous. What are your thoughts about handheld mesh nebulizers? Do you prefer mesh nebulizers or jet nebulizers?
Sure. Thank you for the question. So just to kind of state and level set, nebulizers are tools that we use to turn liquid medication into a form that we can breathe in. And one of the common ones that we see is using something like albuterol for patients that have asthma.
Right.
And so the difference between these two, so the jet nebulizer is going to be more common, a little more affordable. It's going to also be less efficient. It's going to require us using some type of pressurized air or oxygen to be used. For the mesh, it's going to be more portable. It's going to be a little more expensive, but also more efficient. So definitely recommend folks circle back with their doctor, consider their personal circumstances to find which option would be best for them.
Okay, and this next question is coming from Tom, and it's about diabetes or pre-diabetes. So he's asking why the medical community is so vague about the label. He says, I diet and exercise and monitor my glucose, which is trending down, but the endocrinologist won't see me until my A1C is 7 or higher. On my own, I'm controlling it with berberine and cinnamon.
Thank you for the question, Tom. And so just to state clearly, prediabetes is a serious condition. This is where we have a problem with our blood sugar. It's a little too high, just not high enough to be considered diabetes. And in fact, about 100 million Americans have prediabetes, but about 80% don't know they have it at all. So when we've got prediabetes, this increases our risk of heart disease, stroke, and getting diabetes itself. And there are things that we can do today to try and reduce our chances of getting diabetes, because prediabetes in many cases is reversible and manageable. So a few of these things are trying to adhere to a healthy diet, getting at least 5 servings of fruits and vegetables every day, trying to limit going out to eat and limiting fast food, trying not to have more than 2 times per week, for example. and then getting plenty of exercise. So for an adult, that comes out to about 5 days out of the week. We want to get at least 30 minutes of exercise. And we've talked in the past, something as simple as a walk can be beneficial. What we aim for is that weight management, trying to lose 5 to 7% of our body weight. That can go a long way to help manage prediabetes.
What are the signs and symptoms?
For some, they might not have any symptoms at all. And so we definitely recommend folks checking in with their doctor to see if they are eligible or if they would benefit from a screening. When folks do have symptoms, it can be similar to when we have diabetes, increased thirst, urination, that sort of thing. So we want to ensure that folks are connecting with their doctors again about that screening process.
So it sounds like Tom's doing a lot of the right things, controlling his diet, exercising, things like that. But he talks about berberine, if I'm saying that right, and cinnamon. Are those things that can bring your A1C levels down?
Yeah, it's an important question. And currently, those two supplements aren't part of the recommended way to manage or prevent diabetes or prediabetes. Some of what we would advise is, again, that healthy weight management, getting that 5 to 7% of our weight down in the next year. And if folks are looking for some structure, they can consider something like the DASH diet or the Mediterranean diet.
Okay, but just before we go, but those two things, the berberine and the cinnamon, you're saying that there's no research really that supports that, but do they hurt if you're pre-diabetic?
I can't say whether they hurt or not, but there's not high quality evidence that's been generated to allow us to make a confident recommendation that this should be part of the regimen to prevent prediabetes or treat diabetes.
Yeah, and with diabetes being such a problem in our community, it's a good idea to get checked.
Yeah.
Definitely.
Dr. Leo Lopez, University Health, always appreciate your time.
Thank you for having me.
All right.
Thank you.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.